Pop quiz number 29. A client with fistula secondary to Crohn's disease is being treated with a course of glucocorticoids. Which complication of this treatment should you be alert for? A. Constipation, B. Hypoglycemia, C. Dyspnea, or D. Sepsis? And the correct answer is D, sepsis. Now, as I've said in a previous video, let's say you had no idea what the diagnosis was. You had no idea what the pathophysiology of that disease was. You just had to guess. If you're ever in a situation where you have to guess, look at your choices, look at your options, and say to yourself, what is the worst possible option? What is the worst thing that can happen to my patient? And that's what we'll be most concerned about, right? Choose that as your answer. Now, let's say you do understand the disease process. We're talking about Crohn's. And not only Crohn's, it says that, let me go back, it says that the patient has a fistula, a fistula secondary to Crohn's. Patient's got a fistula. One of the worst things that can happen is that it perforates or there's a leak. Now you're dealing with peritonitis. All right. Now you're dealing with a high risk of that patient developing sepsis. This is lethal. This is deadly. That's what we're going to be most concerned about. Let me throw something else into the equation. They said that the patient's getting glucocorticoids. If you don't know anything else about glucocorticoids, you better know those four things. Number one, infection. They mask the signs and symptoms of infection, so you have to monitor your patient much more closely for infection, right? Two, hyperglycemia. It's very sugary. It can mess around and cause your patient to be diabetic, right? It can cause the patient to be hyperglycemic. Number three, what is the third thing? Osteoporosis. They make the bones porous, so we have to be careful. You're going to be concerned about your patient falling or having a fracture because it does have the tendency to make the bones porous. And the fourth thing is ulcers. Glucocorticoids are very hard on the stomach. That's why you give it with food. We don't want GI irritation. We don't want the patient to get an ulcer or a bleeding ulcer. But coming back to this question, they gave us so many clues that should have led us to sepsis. The glucocorticoids, Crohn's, and the fistula. The worst possible thing that could happen out of this list is sepsis.